I'm Dr. Scott Sanderson with Elite Health Hawaii. Our process at Elite Health Hawaii is a very comprehensive, proactive approach to healthcare. So we start off with the initial assessment. The initial assessment is very in-depth. You cannot get a more in-depth assessment anywhere here in Hawaii. We start off with genetics and a very extensive lab panel. We have our patients come in, they take a swab from their cheek, we send that off to England, and we get genetic analysis done on them so we can get a lot of information about that patient. And then we send them to the lab, they get their labs drawn. It's a very extensive lab panel checking all of their hormones as well as all of their basic labs as well. From there, once we have those results back, we bring the patient into the clinic. And in the clinic, they go through a full assessment, which generally lasts almost a full day. We do a DEXA scan on our patients and lunar densitometry, and that's going to tell me exactly where all the fat is on your body, and then it's also going to tell me what your bone density is like. From the DEXA scan, then we move and we do a carotid artery ultrasound. And the reason that we do that is because we're looking for plaques inside the carotid arteries. Because if you have plaques in the carotid arteries, it's very likely that you have plaques elsewhere in your body. We also have our patients check their core strength through having them do some short planking exercises and then just a few crunches. At Elite Health Hawaii, we actually measure your resting metabolic rate. From that, we can tell you the exact number of calories that you as an individual need each day in order to maintain weight or lose weight or gain weight, whichever you desire. VO2 max testing is a very integral part of the Elite Health Hawaii assessment. The patient rides a bicycle for a few minutes. While they're riding the bicycle, they have a mask on their face, and this mask is attached to a hose which goes to our meter, which measures the amount of CO2 they're breathing out, the amount of oxygen they're taking in, and it also follows their heart rate while they're exercising. From this, I can design a highly individualized exercise program that allows my patients to get much better results with less work. So we try to help our patients amplify their vitality and maximize their health span. What we mean by health span is the amount of time in your life that you are healthy and living with the quality of life that you want. And in order to increase the health span, we have to optimize a patient's health. So at Elite Health Hawaii, we don't look to give our patients acceptable health or okay health. We look to give our patients the highest level of health possible so that they can live with the highest quality of life possible.